This segment is brought to you in part by Southwest Washington Medical Center.
Welcome back to Better Portland. Are you one of the many people who put a healthy lifestyle at the bottom of a priority list? Problems can catch up with you sooner than you think, especially if family history isn't on your side. Kara Mack tells us about a local man who suffers from vascular disease and needed the help of his new friend in Vancouver.
Imagine going in for a basic doctor's checkup and finding out your heart could give out at any moment. It happened not just once, but twice for one vascular patient. And now, years later, he lives to thank the doctors who saved his life. We sat down to talk with Mr. Robbie Rogers.
Well, I ended up going to a doctor because I thought I had a sinus infection, and they did an EKG and they found that I'd had some clogged arteries, and I went, and then I ended up having a 5-way bypass. The cardiologist took me back in after about 5 years, and they did a CT scan to just check the grafts that they had put in, and that's when they found the aneurysms that I ended up having repaired also.
Yes, twice Robbie has experienced close calls, which according to doctors is not unusual.
Well, AAA or abdominal aortic aneurysms are a potentially deadly condition that affect millions of people in the U.S. Annually. Most people don't know they have them. They're a painless condition until things get very difficult.
I was really surprised that I had them kind of problems. I had never had any kind of heart problems, or that I was aware of anyway.
Robbie doesn't claim to have lived the perfect healthy lifestyle, smoking, drinking, enjoying life with his wife.
We've been married almost 36 years, and contrary to what his beliefs are, I really did try to feed them very well.
Both attribute his conditions to a long list of family history, but give thanks to Southwest Washington Medical Center for their tremendous treatment. Robbie admits he has had the best when it comes to doctors, including Dr. Karmy-Jones.
He took a great amount of time in explaining the surgery to me and to my wife and the rest of my family. And Dr. Subat said that had he not come down here to work at this hospital, wherever he was prior to, he said that's where he would have sent me to go have him see this Dr. Karmy-Jones.
We have the opportunity to be dealing with variants of these grafts that can be used for bigger, larger, longer aneurysms that are currently only available in Europe right now. We have the opportunity to have them in this country, actually at this institution. You know, you can't help but be worried, but every time there is something huge happen, nothing goes wrong, so you kind of don't get really as scared maybe as you should be. The care that he's had has been so good. There's never been a complication. There's never been a problem.
Now Robbie and Patty live a normal life, including activity and travel.
We're very fortunate. We still do a lot of the things that we like to do. Maybe had we not found this stuff when we did, we might not have been able to.
And Robbie feels?
Very good. Very good. Yeah, I'm very good. Dr. Karmy-Jones is a hell of a man.